I appreciate the introduction and opportunity to be a part of the meaningful discourse taking place today. I'm eager to be able to share on what unlocking organizational success looks like and how well-being initiatives can be connected to tangible outcomes. Thank you all for your time and engagement today. I have been a member of the Wellbeing Index team since 2022. I have a degree in behavioral psychology and am pursuing my degree in IO psychology, providing me with a unique perspective on the challenges facing organizations to cultivate a culture founded in well-being philosophy. Thus far, I have been able to work with many wonderful organizations, endeavoring to support the well-being needs of all individuals within their workplaces. To provide background on the Wellbeing Index, it is an assessment invented by Mayo Clinic to support organizational leaders in measuring and addressing the levels of well-being among their workforce. For over 11 years, our team of well-being consultants, researchers, and thought leaders have worked directly with institutional administrators to help guide their efforts to build a culture of wellness from the ground up and promote the achievement of sustainable well-being. As many of us in attendance today will understand, the concept of well-being is one that has been highly discussed in the past few years. While the topic has taken on a lot of trendy and surface-level iterations, its relevance to organizational flourishing cannot be undermined. It is our goal to work with all those who are advocates of well-being work, to support them in improving their workplace through creating a culture of wellness. We truly appreciate and commend all those who have worked tirelessly toward any and all well-being efforts in both their professional and personal lives. It has been our team's pleasure at the Wellbeing Index to partner with so many leaders as they work to progress their organization's well-being work and contribute to the industry overall. Through the experiences and opportunities we have been able to be a part of, we can better demonstrate what it looks like to connect well-being efforts to all other contributors of organizational success. In the time I have with you all today, we will walk through what current barriers threaten the success of well-being programs, what it looks like to establish well-being as an all-encompassing organizational approach, how to connect well-being initiatives to organization-wide success metrics, and how these results can be best tracked and presented to secure integral buy-in. The points that we will be discussing today are intended to bring cohesion to the topic of well-being initiatives within organizations. With the rapid development of well-being tools and insights, it can be difficult to maintain a cohesive approach to improving levels of distress within an organization. So, it is imperative that we take a step back and begin with a sound foundation. Through the topics discussed, we will better be able to understand the roles of all the different moving parts that contribute to a culture of well-being that is connected to organizational success metrics and is demonstrable to all organizational stakeholders. Prior to exploring the facets of how these objectives help unlock organizational success and wellness, we need to know what an organizational culture of success looks like, specifically in a healthcare setting. First, to define organizational culture, as it can often be referred to as an ambiguous phrase that is used to catch all that we refer to it as. This can be understood, and what I'm referring to it as, the shared beliefs, attitudes, values, behaviors, roles, and systems that organizational employees have and ultimately influence their experience in that organization. Even if your definition of organizational culture looks different, it is more important that there is a shared understanding of what your organization is referring to when targeting this. Research and applied work has demonstrated that it is not any one single aspect of professional culture that is a direct equivalent to organizational success. Instead, it is the culmination of all aspects achieved and sustained, acting on one another, that best allow for ultimate organizational metrics to be achieved. To do this, a culture of well-being should prioritize their professionals, understand that well-being is critical to the mission, and enthusiastically invest in their people to empower professionals to fulfill their role in the most effective manner to approach the needs of success in an organization. Any work that is begun on shaky ground will face the challenges of instability as it attempts to grow and progress. So, it is imperative that the work initiating well-being efforts in an organization is built on a foundation of support and education. Securing support from all levels of the organizational ecosystem, from leadership to the individuals on the front lines, ensures that there is an established level of awareness from the entire organization. This means engaging in sometimes arduous and a slow-moving journey that seeks to engage each level of an organization. Additionally, it is vital that all members of the organization have a basic understanding of what comprises the well-being efforts within their respective organizations. Education and training provides the ability to open up lines of communication and reduce ambiguity. This could mean engaging the organization in a week-long event that focuses on what pillars of well-being the workforce should have an understanding of, and defining what wellness looks like at that workplace. Ensuring that any work implemented is clearly defined and communicated to all organizational members will provide one mechanism of defense against the potentiality for a lack of long-term support. Any effort that is being pulled into many different directions will lack the necessary magnitude to progress in the direction of success. So, it is imperative that both those direct and indirect contributors possess a clear understanding of what goals are being targeted, on what timescale, and with what resources being allocated. These three areas must be clearly and continuously communicated to ensure there is the necessary shared understanding to progress the overall work. This does not necessarily mean that all workforce contributors must attend the same meeting and be a part of the same discussions, but rather that there are huddles or town halls or other opportunities to meet asynchronously, explicitly carved out for these discussions with all workplace professionals. This will also enable the work to become more ingrained in the culture of the organization, establishing the integration necessary to maintain sustainability and longevity within that organization. Working with so many organizations in the space of well-being has demonstrated that there are many facets of well-being an organization could target to address, contributing to the potential for experiencing an overwhelming sense of burden that can accompany efforts to address areas of distress within an organization. Should we target workflow inefficiencies? Should we help people to feel more fulfilled in their roles? Should we provide more opportunities for recognition? The list is endless. For those groups that we have been able to partner with who have achieved success in different areas of well-being, have always established a cohesive approach. This means first centering the work around clearly identified and defined goals. As Dr. Schoenfeld has spoken to, this goal identification process should be centered on the highest priority needs that have the greatest accessibility to resource allocation. This may mean starting with those opportunities that may be cost-free, like providing more appreciation or recognition for a job well done from a direct leader, which can have a great impact, and then addressing the need for reduction in administrative burden by hiring a scribe, which will cost money, but will also have a great impact. The goal should also be centered around positive language to maximize improvements and progression within an organizational culture, rather than focusing on the burdens faced by a group. So, this may look like formulating a goal that targets providing staff with more opportunity to dedicate time to the part of their role they enjoy the most, rather than saying we need to reduce the burden of administrative tasks that employees have to do in their day. This attention to language can ensure that the goals allow for positive interpretations and reception to the work being targeted. This means all those within the organization, not just those directly involved in the wellness work, have an understanding and awareness of what organizational work is being done and why specific well-being goals are being addressed. Among the potential for efforts to be squandered when wellness work is built on insufficient foundations are those challenges faced by leaders who advocate for well-being in their organization. These leaders exist in so many different capacities and roles. To understand the value of these individuals, these are those professionals who have chosen to advocate for the importance of well-being work in their organization and strive to empower their organizational communities to address well-being in the workplace. These leaders may have found themselves in this advocate role due to personal experience they have had, witnessing a colleague's experience, or be impassioned to dedicate their time to well-being work through some other means. It is with these advocates that change can more easily take place. So, when there is a lack of understanding among those decision makers, this directly impacts the ability of the wellness leaders to succeed. From our experience of partnering with organizations in their wellness work, this lack of understanding can be born out of disengagement among decision makers or misconstrued conceptions of what well-being in the workplace means. This means that education and providing evidence-based conclusions on why well-being work matters can make all the difference. It is the role of the decision makers to empower their wellness leaders to be able to access the support and resources necessary to address well-being needs within their workforce. But first, decision makers must sometimes be provided with the necessary tools and knowledge to obtain the integral understanding of the value of this wellness work. Even with the support of decision makers, wellness leaders may have to embark on the great journey of capturing the trust and confidence of a potentially ambivalent, skeptical, or downtrodden professional audience. All of these audience conditions are ones that we have seen our partners have to face and have worked tirelessly to support them in engaging with and establishing trust among their professionals. With the historical prominence and current prevalence of things like survey fatigue, mistrust within an organization, or overwhelming feelings of disengagement, it can feel impossible to overcome these barriers within the pursuit of wellness work. But it is imperative to understand that, much like changes in well-being, organizational development does not achieve complete success overnight. These things must be chipped away at, and they should require that. Things like trust, engagement, and dedication are those conditions that should be steadfast and long-lasting. When an organizational culture reflects on their own patterns of trust, engagement, and dedication, they will want those conditions to remain stable. So, regardless of if these shared feelings are reflecting well or poorly for a group, they will take time and effort to impact. The magnitude and quality of the effort dedicated to increase feelings of trust and improve on levels of engagement will have a direct link to the actual achieved levels of trust and engagement from the professional population. So groups should begin the work now, moving those who are ambivalent and completely disengaged back to a place they may have formerly existed in, of wanting to provide their feedback and input on efforts toward organizational change. It is the job of an organization to not let that feedback fall on deaf ears and to continually reinforce and demonstrate action in response to those who are engaged. If even it begins as an expression of gratitude to a professional who spoke up and provided their perspective, which then transforms into actual action in response to that feedback. There is still work to be done on how we can all work together as a community to better enact and execute cultural change within an organization, to provide for trusting professionals who are engaged. But with consistency and attention to this challenge, wellness leaders can be better equipped to do the work that so needs to be done. As previously mentioned, there are many factors that can lead to lack of sustainability and longevity of well-being work, including a lack of commitment in the long term. Because progression in well-being happens slowly and often without demonstration of immediate major change, the short-term impact of well-being may not always be the most impressive. It is for this reason that the long-term impacts of the work are that much more important. So, those stakeholders of an organization, regardless of their familiarity with the wellness work, should be provided with the necessary education and background to align with and invest in the long-term well-being work of their organization. Organizational change worth the investment and resource allocation will have long-term value and be centered in the need for long-term commitment. From our work with the top well-being researchers and thousands of leaders at healthcare organizations of all types and sizes, we have found that there are common strategies that can help get past the challenges we faced, the first being a reframing of the way we see wellness as just an optional add-on to an organization's efforts, and changing the narrative to show how well-being is in fact an integral and all-encompassing approach that underlies a healthy and thriving organizational culture. As we established earlier, organizational culture is the shared beliefs, attitudes, values, behaviors, rules, and systems that organizational employees have and ultimately influence their experience in that organization, as we talk about it today. Employee engagement, fulfillment, and productivity are all impacted by the functioning of an organizational culture. So, injecting the well-being work of an organization into the tenets of the organizational culture will inevitably contribute to these employee metrics. It is understood that employee engagement, fulfillment, and productivity all have the capacity to cumulatively impact the overall success metrics of an organization. There are many models that identify how these different dimensions of employee functioning as a result of organizational culture interact to produce varying levels of employee production, quality, and quantity. For example, an employee who may feel fulfilled in their specific job duties and purpose may not be equipped with necessary access to all of the resources to produce the best efficiency in their day-to-day work. They may have the necessary factors of motivation in this example, but they lack the workplace hygiene factors to be able to best meet their job demands. So, ensuring that all processes have an underpinning of wellness philosophy can allow for all employee metrics to be better addressed and met. There is not any one employee feature or function that is a direct equivalent to organizational success. Instead, it is the relationship between different employee features that contributes to organizational performance. So, enabling the integration of well-being philosophy in organizational culture will provide those fundamentals in that culture to have the capacity to impact and influence employee engagement, fulfillment, and productivity for the maximization of those desirable outcomes. The organizational culture, mission, vision, values These are all the key words that prospective employees and talent acquisition within an organization look to find alignment with. There is a need to move past the unknown and establish a familiarity between potential employees and their potential employers that is grounded in strong foundations. So, why not begin the exposure to and alignment with cultural norms around well being from the very moment a professional is considering or being considered by a potential employer? It is through this early exposure and all encompassing integration that an organization can be sure to both demonstrate the value of well being to potential employees, to obtain that engagement early on, and ensure that those who may become members of that organization are already in alignment with the well being work and intentions of the organization. This will ultimately serve as a benefit to the organization, as those individuals who value well being work, being among the core tenets of an organization, will possess those qualities desirable in talent acquisition for an organization. With those groups we have been able to partner with who engage their new hires in their well-being work from the moment they are being interviewed and onboarded. They have found those employees more willing to provide their input and express their commitment to their organization, contributing to reduced risks in turnover or loss of valuable employees. Understanding well-being in the workplace and being in alignment with an organization's work toward well-being should not be optional for any organizational contributors. If a workforce intends to benefit from the work of wellness efforts, so it should be established as a standard for all the potential and existing talent within an organization. As we have covered to this point, there are not just minor benefits that are incurred when integrating well-being work into the fundamental culture of an organization, but rather there are integral needs met that are necessary to an organization's success by injecting well-being into the organizational ecosystem. Some of the most basic necessities for a successful organization are reductions in costs and improved sustainability. Without these, we understand an organization can no longer function or prioritize any other needs, let alone efforts toward well-being. Similarly to the hierarchy of needs, if an organization cannot feel assured that they have established foundational needs of financial security and sustainability, they cannot look to address other needs. Through our partnerships with so many organizations, we see many efforts poured into cost reduction and improved sustainability, at times neglecting to consider how well-being work and philosophical integration could further bolster these efforts. When we have seen groups implement measures such as facilitating focus groups to get input from a singular department on what needs to be improved, and then providing solutions such as access to professional development or recognition from leadership, they avoid turnover and incurring such great costs that provide the department and organization with ultimately better sustainability. We work with so many to demonstrate how this work is directly linked to the ability to reduce costs and obtain sustainability, and we will explore how to produce these demonstrable results later in our discussion today. Working with our partners, it is more often than not that we see well-being work has begun as a grassroots project. These are those beginnings which stem from the basic level of functioning within an organization. Whether these beginnings are motivated by an experiential need or anecdotal whispers of distress, we have seen so many impassioned individuals step up and advocate for their colleagues' well-being. While any start to well-being work is a step in the right direction, to ultimately obtain meaningful success as a result of well-being work, it cannot exist as just a facet of the work that is done in an organization. Instead, the work done toward wellness efforts has to be so deeply adopted in and woven into the fabric of an organization. The way that this manifests could be including well-being education into all onboarding and all ongoing professional development. This could mean that each and every supervisor and supervisee has some component of well-being minded philosophies included into their key responsibility areas for their respective roles. Regardless of how an organization chooses to embed the well-being work into their organization, it must be understood as more than just a facet of what an organization does. As the professional community continues to work with, mold, and shape how well-being work is executed within their respective organizations, the distinction between the necessary work provided by human resources and the value of well-being work has become more clear. Necessary human resource work and practices are not the supplement to providing well-being work, but it can be the organizational mechanism that has greatest capacity to influence and enhance the well-being of the professional population. The Journal of Human Resource Management provides insights that demonstrate the two sectors are distinctly different, but that they have the capacity to maximize on mutual gains when there is an effective relationship cultivated between well-being work and human resource work. When considering the areas that are necessary for HR work to dedicate time to, those categories that can be considered are job resources and job demands, that both have the ability to influence different domains of professional well-being. Job resources can provide a positive impact on professional well-being, while the work dedicated to job demands can potentially add burden to different domains of well-being. We have worked with organizations that have integrated well-being awareness into their HR job demand and job resource efforts, mitigating against challenges in the workplace that may contribute to negative impacts on different domains of well-being. This has been accomplished by informing the implementation of productivity demands with wellness in mind and the voices of those who are going to be impacted heard. For example, a department knows best the ins and outs of their day-to-day care demands, so why not look to them as experts on informing the policies that will directly impact their job demands? This will ultimately provide the space for employee self-advocacy, improving well-being, and also promote the desired outcomes of the job demand metrics being implemented by human resources. It is integral for an organization to engage well-being work and human resource work in a relationship that maximizes the potential of one another. The work of well-being does not just manifest as work identifiable as solely related to wellness, but instead, the philosophies of wellness provide guidance on maximizing the success of all systems and policies. The work carried out by so many professionals in the space of providing healthcare comes with its unique set of challenges and burdens. Those challenges and burdens are even variable among the different roles that move the community of healthcare forward. So, when we consider informing the systems and policies of a healthcare organization with well-being philosophies, we are not just referring to practices that enable greater resilience. Instead, we are referring to implementing practices and procedures that get at the drivers of distress and well-being that have the potentiality to exist at a fundamental level of an organization's functioning. These are those drivers identified by Dr. Shanafelt and Dr. Swenson, such as workload and job demands, efficiency and resources, control and flexibility, and several more. Addressing these within the procedures and workflows of an organization will maximize the potential to achieve sustainable and thriving levels of well-being for professionals who are already combating the innate challenges of their roles that they understood when they stepped into the complex space of healthcare. It is the role of the organization to lighten the load in the capacities it can, through injecting well-being philosophies into the workplace policies and systems. One of our wonderful partners, Common Spirit Healthcare, shares this impactful statement. I couldn't personally reach out to 5,000 doctors, Dr. Frey explained. Knowing this, I switched our focus to educating the physician leaders within our organization. The data we could retrieve from the Wellbeing Index proved immensely helpful in leading conversations with these leaders and arming them with the evidence to continue the discussions with their staff. Their goal was to keep this topic top of mind and continue to build a culture of support. This is a pertinent example of a glimpse into what it takes to engage in wellness efforts. It is by no means a small undertaking. So it must be integrated and educated team that this work moves forward and achieves success in incremental ways within an organization. For more information on this case study, it can be found on our Wellbeing Index website. We know that well-being is an integral part of organizational success. But how do we show others this? How do we convince them? By connecting well-being to organizational success metrics. Tying well-being work to an organizational mission is integral. The mission of an organization is both what the workplace stands for and what the workforce moving that organization forward is to be in alignment with. Employees become a part of an organization, knowing what that organization's mission is, and organizations select employees with their mission in mind. We understand that those who may be unaligned with their organization's mission and actions forward contributes to dissatisfaction and ultimately impacts the overall success metrics. So, to ensure that there is alignment between beliefs, actions, and perceptions, there must be continuity between the mission an organization upholds and the well-being work addressed that directly impacts the professionals within a workplace. So, how exactly does well-being work manifest itself in an organization's mission? Prioritization of your most valuable players, your workforce professionals, will undoubtedly contribute to improved quality of patient care provided. So how can we bring a mindset of well-being to both those being cared for, the patients, and the staff? The role of professionals in healthcare is to always put the patient first and can neglect how the employee can be impacted by such heavy work. A way in which this could manifest itself in an organization could be when a surgery department recognizes that there's a disconnect between the surgeons conducting surgery and nurses attempting to contact them throughout the day. This builds up over time and can contribute to potential concerns for addressing patient needs, frustrations between the surgeons and the nurses, and lack of communication between the care teams. After a concerted discussion is facilitated between the surgeons and the nurses, they are able to determine that they will have the surgeons conduct rounds twice in their workday, before and after surgeries, rather than just before. This leads to resolutions to all previous concerns and frustrations, reducing levels of distress. This demonstrates in improvements in both the day-to-day work of surgeons and nurses, while also improving the care provided to patients. Not only did this maximize benefits for both staff and patients, but it was cost-free. It is evident that patient care is integral to an organization's mission, but the solutions are directly tied to staff well-being, not just occasionally tangentially related. Regardless of the organization, there is a value upheld that refers to professional fulfillment in some capacity. It is understood through research that professionals who are enabled to spend 20% of their time on the work they are most passionate about, that is when reduction in levels of burnout can be achieved. We know that spending 20% minimum on work that is most meaningful provides a decrease in risk of burnout, and anything beyond that does not necessarily decrease burnout, but provides for increase in job satisfaction, and that can have differential benefits. To ensure that professionals are able to dedicate at least 20% of their time to work that is the most meaningful to them, this means engaging in communication with staff to understand and structure their roles around that work that is meaningful to them. This should and can be done from the time that an individual is brought on and while they continue to grow and develop in their role. Professional fulfillment looks different to varying professionals, but ultimately has a direct link to decreasing burnout and improving levels of well-being. Wellness work can both impact and be impacted by professional fulfillment when an organization is strategically considering the two in their mission. How does well-being inform quality improvement projects and concerns for safety measures in an organization? Staffing can be an issue, contributing to diminished safety due to the fact that there is both a necessary amount and quality of employees needed to provide sufficient care to patients. So, is an organization concerning itself with doing the bare minimum or actually staffing for optimal outcomes? Is the workforce comprised of complementary care teams that work together in a way providing for ultimate safety and quality and output? Are they trained appropriately? Is the functioning up to par? Is the work provided optimal? There are so many considerations to make regarding the well-being of staff outside of the amount that has to be staffed for, that an organization should be considering when it comes to the level of safety that is being achieved with patient care. Even if this means going beyond the bare minimum quota for necessary staffing members, quality and safety will benefit greatly when wellness considerations are made in the efforts toward quality and safety measures. Dr. Shanafelt has shared that increasing burnout rates has a direct impact on increased risk of turnover. This means they are more likely than average to actually leave their organization. What does this mean for the institution's bottom line? Those organizations that concern themselves with efforts of burnout are investing in cost-saving measures. So, what might direct efforts to engage in retention look like? There is a saying that people don't leave jobs, they leave bosses. So, being able to implement practical change to impact individual well-being and job satisfaction, reducing risk of turnover, is going to occur at the level of direct supervision. Leadership examination to bolster well-being does not need to take on a critical tone, but rather empowering direct leadership through necessary education and training that enables them to better support those on the front line is the answer. Utilizing tools like the Leadership Impact Index that enable leaders to be assessed for strengths and areas of opportunity for growth allows for the necessary individualized needs analysis to provide for the best fit training and education to strengthen leader skills and abilities, ultimately providing improved leaders for the larger workforce. This is a proven way in which burnout can be diminished to reduce turnover and contribute to greater organizational success. What does it mean to go beyond burnout? There are different facets of well-being and risks that have the capacity to impact personnel outcomes variably. When looking at productivity, you certainly need to address burnout, but that alone will not be enough. There must also be considerations made toward job demands and processes. Much like we established in the relationship that should be cultivated between well-being work and human resources, and well-being work and system procedures, there should and can be wellness-minded philosophies that underlie the way role responsibilities are allocated and structured. This could mean productivity is improved through providing a scribe to professionals, reducing the administrative work they have to dedicate time to, and ultimately getting the work done in an efficient and effective manner. There are several factors of professional well-being that impact productivity, which can subsequently improve the quantity and quality of this metric for an organization overall. From a business perspective, medical errors and malpractice are certainly incidents that organizations want to avoid, and they are also instances that have the capacity to greatly influence an individual's well-being. Combating these instances does not mean expecting perfection from employees or micromanaging their every move, but rather providing the necessary supports to avoid these incidents. This means that staff should be provided the necessary education and awareness to avoid these instances. Professionals should also be cared for in order to be able to provide for the best care, so that they can reduce the chances of a medical error or malpractice incident. Because when incidents like this happen, there's also a great weight placed on all those individuals involved in the incident, resulting in potential physical and moral injury, ultimately multiplying the impacts of one incident. This is something that is both a business ethics and individual ethics concern. Reduction in risk of medical errors and malpractice for the individual will ultimately benefit the organization. Exploring this section from the business case for investing in physician well-being, it is not a question of if an organization should endeavor to concern themselves with investing in and integrating wellness efforts. Instead, it is the questions of how and when do we start. If it takes the framing of fiscal prioritization of well-being work, that is where the motivation and buy-in to get the work started begins. All roads lead to home, meaning the investment in wellness work, no matter its beginnings, will prove its worth in long-term sustainability and progress in organizational success metrics across all organizational contributors. Collecting data, regardless of where an organization is at in their wellness journey and work, will always be integral. It may be the first time a group is embarking on establishing a baseline, or it may be the 100th time. No matter where a group begins, resumes, or continues their work in well-being data collection that produces demonstrable results will be essential for securing support from the entire organization. As one of our wonderful partners shared here, leadership buy-in is not an option if you are endeavoring in enacting and executing wellness efforts that will have a long-lasting impact. So, using data enables and empowers so many to be able to obtain needed engagement from stakeholders. The data collection process can be complex and arduous, but if strategically done and put in front of stakeholders with confidence in what is being demonstrated, it becomes an incredibly reinforcing part of the process. Perfectly demonstrated through this testimonial, measurement is key. It is the utilization of data-backed efforts that drives and progresses any successful professional efforts. Data collection is not the end-all be-all, but rather the foundation that allows you to be able to take the next step with greater confidence. You are headed in the right direction with your limited resources. Understanding and tackling well-being conceptually is hard enough. So the tools utilized to support wellness efforts should do just that, support and not detract or add burden to the work. The first that lends itself to the progression of well-being efforts within an organizational culture is a validated means of measurement. You won't know where to improve or be able to show the outcomes of your efforts unless you measure them. And using a validated measurement increases the credibility of and confidence in those results. The Wellbeing Index has been explicitly created to provide an assessment that gets at the most pertinent factors with the greatest potentiality to impact an individual's well-being, while also enabling individuals to engage with the tool as efficiently as possible. In addition to the assessment itself, groups can utilize the tool to be able to specifically identify variables unique to their organization that may be driving distress. These are variables such as time spent on work outside of work or inability to access mental health resources that may be specific to an organization's conditions that can be measured with precision, accuracy, and longevity. This then allows a group to identify what needs to be provided to reduce time spent on work outside of work, or to improve levels of well-being, or to understand how to support employees' access to mental health resources that can move individuals to sustainable levels of well-being. All of this is made possible through the use of a validated assessment. All of these conditions are conducive to providing for meaningful data derived from a validated measurement. This measurement is the first step toward better understanding where needs exist within an organization's pursuits in well-being. In addition to the utilization of a validated assessment, injecting wellness efforts with the necessary connection to organizational success metrics can be done through the use of the cost of burnout calculator. This tool has proven to be a valuable addition to the efforts of so many of our clients and beyond. While the intent of the tool is to ensure all stakeholders are aware of the value and need for attention to well-being in an organizational culture, this tool should be used with incredible tact. It is never the goal of this tool, or tactics similar, to minimize the value of an individual or to shift the focus away from the primary goal, impacting well-being work. Rather, this tool can bolster those efforts and demonstrate the innate value each and every professional brings when this tool is used strategically. Finally, we look to the value of actionable data reporting. Gathering data for the purpose of it being interesting will almost certainly lead to a dead end. We have seen groups dedicate time and resources toward wellness work and have their efforts squandered by the lack of substance they are able to disseminate from surface level data that has been collected and ultimately produced null reports. It is incredibly important that the work an organization's wellness teams dedicate toward well-being is both built on and demonstrated through actionable data reporting. This means using a tool that is able to specifically target those drivers of distress in the realm of professional well-being, because that is what the organization has the capacity to provide an impact on. Data that is founded in actionable insights will promote that organization's ability to act on what they see through data, reported in a meaningful way. Working with so many groups in the arena of well-being, there is often the question of, I have the data, now what? We recognize that collecting data only gets you so far. So it is imperative that through every step of the well-being work, an organization has maximized ability to take action and minimized doing things for the sake of it being interesting. This means using tools that enable you to measure factors that an organization has the capacity to have a direct impact on. When the time comes to review data that has been collected, there will certainly be many opportunities to address needs. So how to identify where the need is greatest? That is where the utilization of tools that can delineate the relative levels of risks for adverse outcomes within their professional well-being is so valuable. Those who are at the highest levels of distress and thus at highest risk of experiencing different adverse outcomes will be in need of immediate and thorough resource allocation, while those who are at diminished risk levels or even thriving will be in need of differential resource allocation on an extended timescale. The Wellbeing Index is able to provide the snapshot of what these varying degrees of risks relative to different adverse outcomes looks like to support this targeted resource allocation. Being able to understand the minute differences that exist between different pockets of need will support groups in being able to take the most necessary action in due time. When needs have been identified and groups are working to prioritize the action to take, there is not a one-size-fits-all, which is why the utilization of data collection that can provide an organization with actionable reports is so critical. While the data may provide a group with national comparisons, and it may be valuable to gain input on what similar organizations do when presented with similar data, the necessary action steps will be singular to each group. When presented with organizational specific data, a group can best customize their next steps by identifying the greatest need and what resources are available to meet those needs. Maybe this means a group first addresses a departmental need for improved personnel training, and then provides town halls or workforce-wide touchpoints to hear from leadership. But throughout all other needs being addressed, the organization works towards eventually providing a fitness facility for the entire workforce when resources are available. This is just one example that demonstrates how those needs that are highest priority and have the greatest access to resources should be addressed first. This can be followed by addressing those needs which have a lesser impact but require less resources too. As Dr. Shanafelt has spoken to, this ensures that while other high impact needs are being worked on, which are going to require greater resources, that there is still action taken to reinforce the meaning of the wellness work and ensure that all stakeholders are continuing to see progression. When engaging in well-being work, there should be stakeholders engaged at every level and every step of the way. It's imperative to the longevity and success of well-being work that those interested groups remain engaged. This means that reinforcement plays a paramount role in this work. So, how to inject impactful efforts of reinforcement onto all those involved in this work? Groups have been able to achieve this when they have communication that is meaningfully frequent. What this does not look like is inundating professionals with even more emails or even more documentation to have to read through with little substance. Instead, this means ensuring that at every touch point, where applicable, that there is insightful and actionable information provided. Through behavioral psychology, we understand that there are several factors that play an important role in the effectiveness of reinforcement. Those being latency, magnitude, and content, just to name a few. This means expedited return on results, expansive response efforts, and meaningful responses can all bolster the impact of reinforcing stakeholders. This could look like engagement with professionals at work unit or department levels regarding what they have heard from the organization and how this feedback is important and invaluable to informing what happens next. This could be the opportunity to meet with those groups in higher need relative to their colleagues to specifically demonstrate a targeted response and high level of attention to concern in their professional population. How the action manifests is going to be pivotal in the increased or decreased professional engagement in and reception to well-being efforts now and in the future. To provide an applied example of the concepts we have covered today, we can look to a recent case study examining the work of Dr. Michael Zagota and the wellness team at the Dignity Health Medical Group that details the importance and impact of gaining leadership and key stakeholder support by proving impact and return on investment for wellness interventions. The wellness team at Dignity Health realized that investing in staff well-being had the potential to save money, careers, and even lives. So to support the well-being of the Department of Internal Medicine's 80-plus physicians and assess the effectiveness of their wellness programming, they began assessing professional well-being. At baseline, they measured the department's initial burnout rate at 57% of physician participants. Understanding that burnout leads to a high risk for attrition, they then looked to their physician turnover rate, which was measured at 13%. Using the cost of burnout calculator along with their validated measurement of physician burnout, historical physician turnover rates, and their cost to onboard a new clinician, Dr. Zagota's team was able to determine the number of physicians in the department turning over due to burnout and the corresponding cost of the organization. With this data, they calculated that the department was losing roughly 4 physicians to burnout annually, with a cost of roughly $1.9 million per year. Committed to supporting staff and saving the institution's vital resources, Dignity Health invested in an evidence-based wellness program, implementing several strategic initiatives alongside measurement, including hiring an organizational psychologist, developing a peer mentorship program, launching a physician leadership intervention, and improving system processes to maximize practice efficiency. The annual cost of their new wellness programming totaled $120,000, with a projected reduction in their physician burnout rate of 20%. From these strategic initiatives, the Department of Internal Medicine was able to dramatically lower its burnout rate and corresponding physician turnover, saving Dignity Health over $370,000 with a 210% return on investment per year. It has been demonstrated that long-term success and sustainability for an organization and its relative success metrics depends on the establishment of thorough, proactive, and responsive efforts toward well-being. These efforts should not and cannot exist in a silo. Similarly to any organizational efforts and norms that are fundamental to an organization's functioning, well-being work should be the standard across the entire organization, not the exception. To prove the importance of and the efficacy of the work you contribute toward professional well-being, there are many tools accessible and applicable to all professionals that can support and bolster the work an organization works tirelessly toward in cultivating their culture grounded in well-being. Ultimately, well-being efforts in an organization are no small undertaking and thus should not be treated as such. Any organization at any level of well-being comprehension and competency should and can enter into their endeavor of integrating well-being into their fundamental organizational culture, but with the understanding that the work must be grounded in permanence and backed by dedicated resources. It is with the investment of the entire organization, integration of all efforts, and workforce education and awareness that an organization can see success metrics bolstered and a culture centered in professional well-being realized. I want to thank everyone in attendance for their work in the space of professional well-being. No matter the span of your work, the impact is far greater than you may know. There are both measurable and immeasurable outcomes of well-being work with long-standing effects. So it is as an entire community that we can work to multiply the efforts and outcomes of the work we all contribute to our colleagues, organizations, and collective communities. Thank you for your time and engagement today.